BBC Radio Sheffield, you're listening to Paulette. Good morning. So we know that junior doctors strike action begins today, taking part in a 4-day strike, expected to be the most disruptive strike in the NHS's history. Feels like a good time to be talking about the challenges facing our healthcare system and what we can do to stay healthy ourselves. So this is the aim of an event coming to the Crucible in Sheffield next month. Our local GP, I nearly said MP, but it's GP for now anyway. Yeah. Dr. Ollie Hart is involved in the event, and he's going to tell us a bit more about it. Morning, Ollie. How are you?
Morning, Paulette. It's lovely to be in a room with you. Wow, how about that?
It's lovely to see you, and you look like you've caught the sun, and you said that was in Whitby this weekend.
It was good northeast coast wind brash. That was it. Yeah, lovely.
I'm jealous. I love Whitby. So tell us about this event next month then. It's an interesting event. It's in the Crucible.
It's in the Crucible, in our home, sort of, the cornerstone of Sheffield. Yeah. It's great. It's really exciting, actually. I'll tell you a bit more about what metabolic health is in a minute.
Please.
But we've got sort of world leaders coming from all corners of the globe to have a conference in Sheffield, 2 days, aimed at a mixture of kind of clinicians and experts, but very much the public as well.
Right.
To help them sort of understand about metabolic health and hear from really cutting edge speakers. It's going to be great, actually.
So health professionals then you said it open to the members of the public.
Mixture.
It's quite expensive though, isn't it?
Well, yeah. I mean, it's if you join the group, it's 165 quid for 2 days.
That's a lot of money.
It's a lot of money, yeah. But you may find your workplace would pay for it. You might find you could write off against tax, which what a lot of people do if they're working for themselves. But you will get to join in and hear from people who, it might change your life. That's the thing.
We want that, but let's just talk about the people that are actually going to be a part of this then, the people that we can listen to if we can afford to come along to this event.
Yeah, I know.
Who have you got talking to us?
Well, it's funny. It's a really interesting time. So there's a GP from Southport I've really admired for a long time, a guy called Dr. David Unwin, and he's quite notorious now, really, because he's managed to reverse type 2 diabetes in half the patients that have engaged with him, which is kind of coming up to 200 people now, which is incredible, really. Mm-hmm. And the way he's done it is by sort of helping people to get to grips with how they look after themselves, manage their metabolism, which we're going to talk about a little bit in a second. So there's David, but there's also a big professor from Newcastle called Professor Roy Taylor, and there's always been this sort of slight standoff. Is it low calories? Is it low carbohydrate diets? Is it different things which you do? But what I think the Public Health Collaboration who are hosting this are doing, they're bringing together all the different sort of thoughts. So it's really aligning and making it easier for people to understand. So Roy Taylor is a really eminent professor with practitioners like David, and actually his wife Jen, who's a psychologist, has been really integral in this as well. So it's a collaboration of people bringing just the best of evidence together.
There's two things here that I'm thinking of. The first thing is, why aren't these people talking to doctors that are training so that they can bring this information into GP surgeries? That's quite crucial, isn't it? Especially if it's new stuff, if it's a slightly different way of doing things.
Yeah, and they very much are. I mean, their website has all sorts of resources that we use every day as GPs. I mean, it takes time to change things, doesn't it? The medical profession particularly, I think, is quite sort of traditional, and probably for good reasons at times, but it does take a while before people sort of trust and understand, and it kind of winds its way fully in. But as well as those other two, two local people, there's international speakers. So Benjamin Bickman, who's a really quite famous, really sort of a researcher around insulin and insulin resistance. So there's a range of speakers from all around the world. So it will be. It's great to think this is in Sheffield, and you can watch it online. Actually, you can tune in online, which has very little cost, as I understand it. But it's good to be there in person, because you'll get to kind of mingle and mix with people. And I think the folk of Sheffield that come out and engage in this will be the people that are really interested in in living well together. We want our city to live well, don't we?
We do want our city to live well. We're going to talk about, because this is something that you've always talked about, our own responsibility for our own health. We'll talk about that, and also crack this code of metabolic health.
What is metabolic health?
What is it?
Yeah.
We'll have a bit of Gabrielle before. Ollie Hart in the studio, which has not happened for years.
I know, it's lovely, isn't it? Yeah.
And we're talking about this event that's happening at the Crucible next month, which we've gathered is expensive. You said it's really for health professionals.
It's not cheap. Well, actually, I mean, it's aimed at the public as well, but I guess the quality of the event will be such that they do have to charge for it. And I suppose that it's a charity that runs it, so you'll be supporting this movement, I guess, to try and help improve people's metabolic health.
Yes. So what charity is it then?
So it's called the Public Health Collaboration. So it was set up by a group of GPs and healthcare professionals around sort of 200 ambassadors across the country now. But I mean, you talked about how you change the medical profession. It takes a lot of effort, you know. So this charity, I guess, is driving to educate, to sort of support people, to make it easier to kind of do the right thing in the context.
Support patients or practitioners as well.
Support patients, but also practitioners to support patients in a different way. You know?
Okay, then. And what about the junior doctors then? What about all of that?
No,
you know,
it's terribly sad, isn't it? You know, junior doctors will be mortified that they're doing what they're doing. You know, to get to the point where you actually have to go on strike, it's just extreme, isn't it? You know, and I think for me, it just represents where we're all at as society at the moment, isn't it? There's a lot of angst, isn't there? You know, junior doctors face just a lot of aggression and toil, and you know, sort of on a day-to-day basis, their jobs are pretty poor at the moment. And so when your pay is also really behind times, I think it's a kind of a terrible mix. And it's not just junior doctors, isn't it? Everyone across the board, I think, is rallying against their conditions. Maybe if we're working together a bit more and we're kind of like collaborating a bit better, then you tolerate perhaps less pay because you enjoy your work. When the conditions are really bad, you then look to be justified in other ways. And I think sometimes a bit of that happens, you know, across the board.
Let's talk about metabolic health then in all of this, because, you know, at the end of the day, if our metabolic health, I think you're saying, is good, it means that we have less connection with the NHS in general anyway. So what is metabolic health?
Well, it's a really important thing to understand, and probably people don't. So your metabolism, you know, people have talked about it, my metabolism running, you know, it's really like your kind of energy source of your body. It's like your engine, if you like, of your body. It drives everything, you know, it drives how your muscles work, how your brain thinks, you know, and, you know, we need to support our engines well. And that is primarily, I guess, the fuel that's going in. That makes a big difference. So what we eat and how we eat it. But then also you know, how we run our engine. You know, if we're revving it full foot to the floor all the time, it's not so good. If we don't give it a chance to recover daily, you know, humans have to recover by sleeping, you know, and your metabolism recharges when you sleep. So I guess it's about all these things together. But, you know, a lot of these things we can do for ourselves. You know, they are very influenced by the conditions we're in, you know, so if we can't afford good food, if we haven't got access to it, you know, makes a big difference, isn't it? If our jobs are hugely stressful and we can't get sleep or manage our stress, our metabolism doesn't work well. But what I've realised as a GP and a doctor is that medicating for your metabolism, so giving tablets and sort of medical approaches, are nowhere near as good as what you can do yourself and supporting you in how you lead your day-to-day life. But that isn't easy. No. So what we're shifting a bit in health is shifting away from just giving people pills and tablets to saying, actually, let's support you to look after your metabolism really well, but we know that's difficult, so we'll support you with good support that works for you as where you are at the moment.
Right, so we're talking about our engine. I like that analogy.
The engine, yeah, I think it's like your engine, yeah.
I was talking to Toby about this earlier, and he had a scare last year, and it's led him to give up the cigarettes, give up the booze.
He's telling everybody, isn't he?
Doing some exercise, and he said, you know what, Paula, I wish I'd done this 10 years ago, but he said I wouldn't have it. People were telling me I needed to do it. I didn't do anything about it until I had the scare. That happens with a lot of us, doesn't it? We don't actually respond unless we have something that, you know, someone said to us, right, if you don't do that, this is going to happen.
Yeah, well, interestingly, isn't it? Sometimes things scare you, and that it can be a really big push, can't it? Big motivator. But actually, more often than not, scare tactics don't really work.
No.
You know me, I'm really into what we call health coaching. So the coaching style, I guess, is finding out what really matters to you in life. You know, if you had more energy and, you know, sort of more zest for life, what would you do with it? What would be the things you'd really like to do? And if you can tune people into that, then you can find motivating factors that don't have to be a massive catastrophic event. And, you know, but the skills to do that, you know, we have new health coaches in the NHS now. We have social prescribers that connect to groups of people that support you. So there's a range of things that are built around how do we support you well in the community that you live in the situation that you're in individually.
Blood pressure. There's a lot of focus
you
on
always
blood
like to
pressure.
talk about blood pressure, don't you?
I know I do, because I'm always getting nagged for mine, you know.
Yeah, no, and it's important.
I am
it's
African
an important
Caribbean,
factor.
so my blood pressure tends to be high. You know, I've got a propensity to high blood pressure. I got a text through from my GP to say you need to measure it and send us. Is this, you know, are we all going to be on statins at some point then?
Well, interesting, isn't it? Sort of like, you know, I guess it would be lovely, wouldn't it, if the solution was just a quick pill. We don't have to think about our health. We just pop this pill in our mouth once a day and that's it, you know. But actually, you know, it doesn't make sense, that, does it? It isn't like that. You know, pills can help a little bit, but personally, I think we've over-egged them. Do you know what I mean? They if you look at the proportion of difference, you know, pills might and the medical model make about 10% difference to your overall health in the longer term. But the things you do, the social situations you're in, your work and housing, all those sort of things make a far bigger effect. Most studies say sort of 5 to 10 times the effect of the medical effects. So sort of 50-60% of your health is related to what you do day to day.
To what I can do for myself.
It is, so measuring your blood pressure is one thing, so you know what it is, but then so what? What do you do about it? And we know that the way that you eat, the way you move, the way you manage your stress, those things have a huge effect. And they sound overwhelming and difficult, but they're not. I guess the public health collaboration and people like, the range, a huge swell of medical professionals now getting behind this, are really interested in how we make it easy and manageable for people to do this day to day.
Is it all right if I keep you for 10 more minutes after the travel?
Paul, I'd stay all day with you. Yeah.
Get in touch if you've got any questions to ask Dr. Ollie Hart. You still are a GP. I know you're not kind of...
I am, yeah, absolutely. I stepped away from the Sloan practice I've been for 18 years. Last summer, a lovely practice. I really missed the patients and the staff. They were brilliant. But I was drawn to put my energy into health coaching and to how we try and work collaboratively across communities to build people's ability to get involved. So that's what I put all my energy and efforts into now.
We'll carry on talking about health coaching. Ollie Hart's with us. Get in touch. I'm going to call him Dr. Ollie Hart because he is a doctor. Well-being, it's mental health and emotional health as well.
Completely. Well, that's really, we can't separate physical and mental. We are people, aren't we?
Yes.
We think and we do, we act. So your metabolism really important for your mental health. I think you had is it Mandy?
Yeah, Mandy's got in touch. She says she's been down. Just let me just say 0800 111 49 49 if you want to give us a call, or text us on 81333 starting your message with Sheffield. So Mandy's got in touch.
Yeah, great.
She says she's been diagnosed with bipolar 2 a year ago. Bipolar 2.
Yeah.
I'm 62. Can I help myself to be mentally well as taking the medication? Mandy wants to.
Yeah, absolutely. So your metabolic health really important for your mental health. Conditions like bipolar. In fact, there are speakers at the conference talking specifically about that. Now, there are times like with any health condition where you're in a crisis, you're in a real hole, and medication can be really, really important in that situation. So I wouldn't want to belittle medication in bipolar. But we know that actually managing your lifestyle, managing your diet particularly, has a massive effect on your mental health, and particularly serious ones like bipolar where you can have sort of, quite serious symptoms. So, a lot of ground to be made up there.
Right, so there are, so it's about, when you say, a doctor says lifestyle, you need, I've had this said to me a couple of times, you need to change your lifestyle. We're talking about foods, we're talking about energy for the engine, but we're also talking about exercise possibly. What would you recommend then to Mandy? What kind of things does she need to do?
Probably 4 key areas, like I say. What you eat, and the key to that is real food. So unprocessed food, not food without ingredients, because good food is ingredients. How you move. So keeping. We're designed. As bodies, we're designed to move. So just walking. Moving around doesn't have to be putting on Lycra and going to the gym. How we manage stress, really important. Things like mindfulness, meditation and relaxation and so on, but just how we just manage stress generally.
It's interesting that doctors are now talking about meditation, whereas 20 years ago people were like, you're a bit cocoa if you're doing meditation.
Yeah.
But now that's been embraced as one of the ways that we can take care of ourselves.
It's just another skill set we can learn. Just we build it into little habits in our life.
And how do we learn that then? And where do we get that information from?
There's loads of really good stuff online now around meditation. I would the NHS Choices website has links for meditation and stress relief. So you find, even the it's a big part of the Buddhist practice, and there's some Buddhist centres in Sheffield that don't push kind of religious sort of style of thing, but they do teach you to meditate really well. So I'd really direct you to those sort of things,
and that can help all of us, any of us.
Oh, absolutely. Yeah. It retunes, if you like. If you think of this engine analogy, I think kind of managing your stress sort of is like retuning your engine, really. It's almost like our engine has a really kind of a really sort of sophisticated computer, like most modern cars now. And that's, if you like, that's our brain.
So it's kind of switching it off and switching it on again.
Well, you could reboot it with a real big bang, but most of us need it to be working all the time, don't we? So just sort of retuning it is really important. And the last big thing is sleep. Sleep's really important. We recharge when we sleep. We do all our healing, both emotionally, mentally, physically when we sleep. So getting good sleep is very important. So I guess when you're addressing metabolic health, you're thinking about how to cover all these things in a manageable way.
Yeah, metabolic health is something that we all need to be thinking about. So, Mandy, thank you for that. Thank you for getting in touch with that. Very good question. Got a message here, no name on it. It says, "Hey up, Paulette, this diabetes costs 160 quid. Should be NHS funded. It should, shouldn't it? Because it's trying to encourage us. Diabetes is a killer, and it is a killer. Affects lots of things. You saying that it's possible to turn that around with a lifestyle change. So surely we should be able to say, well, give us 160 quid and we'll go to the course, and hopefully that'll mean that we.
Well, I suppose this is a specific thing, isn't it, with kind of particular kind of cutting edge speakers. But the NHS does fund education around metabolic health, absolutely. So if you are diagnosed with type 2 diabetes, one of the things that the GP will do is connect you with some education resources. So there are courses you can go on. There's increasingly GP practices are organising kind of groups where you can get together with other people. We certainly do that in our network now, where you can learn with other people like you how to, again, it's all about how to make it manageable, isn't it? It's so easy just to wag a finger and say you ought to do that. But we know that doesn't work.
No.
It is about finding growing your own internal skills, and supporting in the right way to do that.
So it is a worrying time in a sense for patients, isn't it? I mean, there's the whole thing about the strike action. That is kind of one layer of things. But in terms of, and we've not mentioned the C word yet, COVID. We've not mentioned the impact.
I know, we've gone past that, haven't we?
But that's had on us. There are people living with long COVID. More and more people are finding that they're living with long COVID. There are people who had changes around having COVID that have not really come, their bodies haven't completely readjusted yet. And there are practices, GP surgeries have been altered, has been altered forever due to COVID. So how's that factored into this whole equation then?
Well, it's tough, isn't it? It's tough. And then, we've got a legacy of COVID, haven't we? Of kind of waiting lists and of probably a sort of feeling of frustration, isn't there? That sort of, we're not being... I don't know what's the right word, really. I think I just sort of sense it tangibly, don't we? That we've all got a little bit shorter with each other because we've come out of COVID with kind of less time and resources available for everybody, and we're all desperately keen to sort of get back to what we had before. But so there's a degree of patience and teamwork we need to do as a society, I think. But I mean, not to tie it all back to metabolic, but COVID is a classic kind of thing where your metabolism got hit by COVID as a virus. It really attacked your metabolism. So learning to refine and retune your metabolism is a very important part of managing COVID and other viruses like that as well. It's an important part of our defences for life, really. Yeah,
and it taught a lot of people as well to stop, because with a flu you could take paracetamol, well, not flu, but a cold, you could sort of, blow your nose and take paracetamol and go through it. With COVID, I had to stop. I had no choice. I couldn't just carry on doing even the laundry and stuff. I had to stay in bed and just stay down until it went. And then after 2 weeks after, I still need, a friend of mine was saying, I had it in January and I'm still tired. So we have to listen to our bodies in a way, I think, with COVID, that we're not kind of used to it. We used to being able to get a pill to sort stuff out, aren't we?
Yeah, well, I mean, maybe that's a good legacy of COVID, if it reminds us that actually we do have to look after ourselves. And it was a big shock to the whole system, wasn't it? To shut the country down like we did was extreme, wasn't it? And probably necessary. We had to do that at the time to control it, but it's forced us all to sort of slightly reappraise things, isn't it? When people were very frightened, people had to adapt to very different ways of living for a while. So it'll have its kind of ripples for us individually and as a society for ages, won't it? But I mean, I'm always an optimistic sort of fellow, and hopefully we can turn it to positive, because we can realise that we do need to work together as communities. We do need to look out for each other. Some of the stuff that happened in COVID like that was fantastic, and we do need to look after ourselves. If we want our bodies to respond to threats like new viruses, but also just day-to-day living, we have to look after ourselves.
And we do have to look after ourselves, and I suppose what you're working on is a future where we take a bit more responsibility, we take care of our metabolic health, and it means fewer sort of connections with the NHS, that it's a bit more of a prevention than cure way round.
Yeah, those are all good ways of looking at it, Paulette. And I mean, the worst thing I'd ever want people to think is that doctors like me want to just sort of like get rid of you and kind of we're not go away, we don't want to see you. We're about realigning that relationship. Primary care, for me, the strongest thing about primary care was having really really good and mature adult relationships with, with kind of doctors who've learned some stuff and patients who are learning stuff, how to become wise about living your life, how to look after yourself, how to look after your family and your loved ones, and that relationship's key. And general practice is, I think, maybe got slightly shifted towards the very medical model, but our key ground is that interface between the clever science, which we do know, and it's growing all the time, but then crucially the kind of real life community living, and that it's the interface that matters. You can't have one without the other.
No, care and the dealing with the isolation and all of that.
And general practice is great at that, and I really hope we'll kind of regain that ground as GP practice and primary care teams. We're sort of widening the scope of it now. We're bringing in, like I say, social prescribing link workers and social teams. We're bringing in health coaches. We are bringing in sort of physios and pharmacists to work together with doctors and nurses. So we're building a team, and the patients need to be part. Peer support, looking after each other as well, is a really key aspect of that.
We're going to have to continue to talk about this. I think.
Sorry, I'm talking
Dr.
too much.
No, it's good. Dr. Ollie Hart, thank you very much. If you want to find out a bit more about metabolic health, just go to phcuk.org. Is that right? phcuk.org.
Yeah.
Lovely to see you, Ollie. Looking
lovely.
so
Well, do come to that
fresh.
conference. I'll be there. Look